My name is Ann Alford, and I'm going to be discussing bulimia nervosa. As part of this discussion, I'm going to be going over the diagnostic and associated features with the disorder, the prevalence, etiology, treatment, and course and prognosis of bulimia disorder. So let us begin. First of all, it is a feeding and eating disorder in which a person eats a large amount of food and then purges that food in an effort to maintain or lose weight. In order to receive a diagnosis of bulimia nervosa, the individual must meet the following criteria. Criteria A is that there must be recurrent episodes of binge eating. A binge is eating an excessive amount of food, a larger amount than what the average person would consume in a 2-hour span. During this binge, an individual experiences a pattern of uncontrolled eating in which they are unable to control how much or what they eat once the binge starts. And some individuals feel as though they dissociate when they binge. Now, there's a lot of shame that goes into this that a lot of people who experience bulimia feel, and so they do these behaviors in secret. And sometimes they plan these binges out to be in secret, be alone with the disorder. There's a variety of different foods that people can binge on. The type of food is not really as important as the amount of food. The amount of food characterizes it as a binge or not, but usually people tend to binge on foods that they would normally eat, things that they would try to avoid, sometimes like fatty foods or bready foods, or something like that. Criteria B states recurrent inappropriate compensatory behaviors in order to prevent weight gain. This would include vomiting. Sometimes people use their fingers or an object to induce their gag reflexes in order to vomit. Or they'll, in some cases, not as many, Ipecac syrup in order to make themselves vomit and throw up. They will also sometimes misuse laxatives in order to create a bowel movement, in order to excrete the food that they've just binged. Diuretics, they'll manipulate medications. Diabetic medications, sometimes they will omit it, or they will reduce the medications in order to lower their metabolism of the food that they consume during the binge. Or fasting, just going long periods of time without eating or drinking anything, or however they want to do the fast in order to cut down on their calories. Over-exercise, sometimes they'll overcompensate by exercising maybe too much, spending hours upon hours in the gym to burn off as many calories of that binge as possible. And then that's about it as far as vomiting or as far as bringing up the binge. Criteria C states that the binge eating and inappropriate compensatory behaviors both occur, on average, at least once a week for 3 months. 1 to 3 episodes a week is considered mild, with 4 to 7 episodes being moderate, 8 to 13 episodes being severe, and 14 or more episodes being severe. Criteria D, which is self-evaluations unduly influenced by body shape and weight. Individuals may feel that a thinner body may make them a better person or a more likable person. So how they feel or how they look on the outside determines what type of person or how they feel about themselves. And then criteria E just states that the disturbance does not occur exclusively during episodes of anorexia. So the criteria can't overlap, I suppose. So now for the associated features. The individuals who are diagnosed with bulimia nervosa usually fall within a normal to overweight weight range or BMI. it does occur, but very rarely will someone who is obese be bulimic. Typically, females will experience an irregular period or a menstruation cycle or an absence of a cycle at all. Purging creates fluid and electrolyte imbalances that could become serious, and oftentimes that's how medical professionals can tell based on tests if a person is bulimic. Potentially fatal issues include esophageal tears, gastric rupture, cardiac and skeletal diseases. Also, the teeth begin to decay as the enamel is worn off, and knuckles can form calluses where they come in constant contact with the teeth from forcing the finger down the throat to induce the gag reflex. Wow. And rectal prolapse is caused from laxative abuse, and all kinds of other intestinal problems can occur from misuse of medications, purging, and laxative abuse in general. The prevalence, according to the DSM-5, states that there is a 12-month prevalence of 1% to 1.5% of females. Bulimia is not as common in males as it is in females and has a 10-to-1 female to male ratio. Males, for unknown reasons, aren't likely to seek treatment, which is probably the cause why there isn't a whole lot known about males with bulimia, or as much known about males with bulimia. And even though it does state that there's a higher number of Caucasian women more likely to develop bulimia disorder, other races have been known to also have these symptoms or be diagnosed with bulimia disorder. But there are different reasons why their numbers may not be as high, they may not report as often, or they may not be diagnosed or seek treatment. Etiology. The onset of bulimia occurs between adolescence and young adulthood. It is not as common for the onset of bulimia to occur before adolescence, although it does happen, and there are a few cases where there are girls as young as 8 years old who have been diagnosed with anorexia and bulimia. And it is not as common, likewise, that after the age of 40 you would have developed bulimia or onset for the first time. Bulimia does not have an exact cause. There's no one particular thing that causes bulimia in all people. There are several risk factors, and of these risk factors, people usually develop the disorder. It usually emerges as a result of strict dieting. Restricting food and calorie intake and starvation diets, basically, usually result in binging, which results in purging. In some cases, in a lot of cases, when this develops. Traumatic events such as sexual or physical abuse often have been known to trigger or to start the risks of bulimia. Any other stressful event in which the individual may result to purging or binging and purging in an attempt to cope with the anxiety, pressure, fear, pain, or anything else that they may experience, or symptoms that they experience. Poor self-image, and believe it or not, boredom. A lot of times, boredom is the start or the cause of a bulimia episode or a binge and purge episode, which may result in the actual disorder. Now, as far as treatment for bulimia nervosa, there are several different ways in which people are treated with bulimia nervosa. There's in and outpatient therapy, in which an individual may benefit from a support group. There are several rehabilitation centers that people opt to go into, where there's a combination of therapy treatments used based on that individual their individual needs. Cognitive behavioral therapy, where the individual might keep a diary of behaviors and thoughts and food. Then they may be exposed to stressors. Then the exposure response treatment. They'll be exposed to stressors that would normally trigger the disordered behavior, and will be introduced to new coping skills that will replace the maladaptive behavior. Psychotherapy and antidepressants, among a lot of other different things that people can use. Those are probably the main sources, the main treatments that people use to treat bulimia. There are several different types of medications that can be used to, along with antidepressants, to stop purging behavior, stop the reflexes and things. Because oftentimes with individuals with bulimia, they are to the point where they can induce the gag reflex at will, and sometimes the medications can reverse that, help stop that, if that makes sense. And now for the course and prognosis. With bulimia, the disturbed eating may continue for several years, chronically, or with periods of partial remission. Eventually, the symptoms diminish over a longer period of time, especially with treatment. Individuals who have been successfully in remission for a year or more have a greater outcome of success in the long run. There is a high rate of mortality, being 2% in a decade, including suicides. And individuals with bulimia also have been known to cross over into other feeding and eating disorders like anorexia nervosa and binge eating disorder. As said, within criteria E, they cannot occur at the same time, but there are often times when a person will strictly go into restrict mode and meet all of the criteria for anorexia, and therefore crossing over into anorexia, or on the reverse, meet all the criteria for binge eating and would cross over into binge eating. It is also very common for individuals with bulimia to also have other mental disorders like depression, bipolar, and other anxiety disorders. So, thank you and good night.